Hi, good afternoon. This is your Rockland County Executive Ed Day, and we're here for our weekly COVID-19 update. I want to thank you all for joining us here. There's one subject I do want to get into before we get into the COVID update. On Tuesday night, a couple of nights ago, the Rockland County Legislature approved an amended 2021 budget. We now have 5 business days to look at the amendments, ensure the accuracy of the financial details. In particular, we're going to be looking closely at the changes made by the legislature for sales tax revenue expectations. There were title and banding changes for legislative staff and the reductions in the cost of health insurance benefits to the county, and also the Department of Health relief line. A lot of concern was expressed by the health commissioner on the changes that were made. We're going to follow that up much more closely. And the most important thing is that we have to ensure that any changes were appropriate and legal, and they provide you, the Rockland taxpayer, with the lessened tax burden now and in the future that is based on real numbers, not based upon inflated projections, which, as you recall, some years back, that was the order of the day here in county government. That no longer occurs, not under my watch, and we've talked about that extensively. The good news of the budget season was the updated cost of health insurance benefits, what we have to pay to provide coverage for our employees. On Tuesday afternoon, it was actually at 2:42 p.m. We get an email that the change, the estimate now for the increase in health insurance would be only 2%, as opposed to the 5% we projected based upon the history of what we deal with. Typically, we've faced increases of 6 and 7, 8%, which really makes budgeting very difficult. So we went with 5%, which we felt was fair. When we learned that it was 2%, we sent off a communication to the legislature, who was meeting Tuesday night that evening. At that point, it's really something that's in their hands. All we can do is recommend at that point. But we did recommend that, based upon the communication we had, that the savings that we will receive, which is a couple of $1 million, will be passed directly to the taxpayers in the form of a reduced property tax rate. The legislature had already lowered the 5% number to 3%, and that was based on an educated guess after confer with their outside auditors. We based our recommendation on hard data and the latest numbers. The bottom line for our taxpayers is that we understand the pandemic has caused a financial strain, and so many through job loss, a new need to take care of children who are out of school. Excuse me. It is only right that we do everything possible to lessen the tax burden on our residents as much as we can without impacting the conservative budgeting practices that we have been utilizing to help get this county back from the brink of bankruptcy. And again, so people understand their tax bill, county taxes roughly about 10 to 12% of your total tax bill. Typically, the largest portion of your tax bill is your school system, and town would come in second to that. So what this comes out to right now, as it stands, and again, we're going to finalize this, instead of our residents paying approximately a $3 a month increase for the county property tax bill, the reduction looks like it'll be about $1 per month now. And again, bear in mind that we have gone through a lot of crisis here with the COVID pandemic, and we did a lot of work, and also we're paying down a deficit bond, $13 million a year. That's a lot of money, and it's the equivalent of about a 10% county property tax increase. So we were able to get that number down to about $1 a month, which I'm sure will make everybody pretty happy at this juncture. Also, I want to address something, and it's very frustrating when you're trying to deal with people in an upfront manner, that you have to get, I don't mind political backs and forth, but when it gets crass, when it gets to be absolutely inaccurate, it's just wrong. There were a couple of comments that were made by a couple of members of the legislative majority. Our chairman made a comment that when I proposed the budget, that I made dire projections and predictions as what was going to happen. Here's what actually happened. On August 4th, after requesting a meeting with the legislative leadership, we laid out exactly what we were facing. What I find frustrating is a number of the members of the legislature were here back in 2008 when we almost went broke, and because nobody took any action. So I took a highly unusual step of presenting a financial plan to the legislature back in August, and asked them to look at it and gave them a month to come up with their response, in which they came up with nothing. But the point here is that those projections, not predictions, projections, came from the New York State Association of Counties, it came from the state of New York, came from the controller, it came from financial experts in the field. It came from real receipts we were seeing a 45 to 50% drop off in sales tax revenue, which is our number one revenue here in county government. So to characterize this as dire predictions on my part is patently false. What it was honesty, which is what I would think that the chairman would like to see, is where we were at that time, that snapshot of time, and to take the necessary steps to prevent what occurred back in 2008. Because the failure to act back then ended up, as I said then, I've seen this movie before and I know how bad the ending can be. We ended up paying tax rates increases of 30%, of 11%, and 18%. I mean, those are staggering numbers. And we were still going into deficit even worse. So my point was I wanted to prevent that from happening. So I want to be clear with the people of Rockland County that I'm watching out for your money and doing it the correct way. I don't want any people to think it's differently. And there's another comment made by the Budget and Finance Chair, which really does rankle me, frankly. He said that I've been constantly underestimating sales tax revenue, essentially overtaxing our residents. Now that, frankly, is he should know better since he is the chairman of the Budget and Finance Committee. What has happened before, when he was voting for budgets a few years back, there was a ridiculous overestimation of sales tax revenue, and of course that created a deficit I inherited, created a need for double-digit tax increases. So the audacity I see here is really kind of frustrating. But at the end of the day, all we have been doing is we have been putting in budgets that made sense, that were conservative, that were getting us back on the road to recovery. We were finally getting to a point where we had a positive fund balance or a bank account, such as it is, that was expected to be at a certain level by the New York State Controller. It's roughly 10% of your gross budget. We were approaching that number when the pandemic hit. If we had not had that kind of money in the bank, so to say, during a crisis, we could have gone bankrupt again, which would have been not bad. We're going to deficit again, which would have been horrible. So, I make no apologies for taking steps in this administration to make this economy healthy. I will not apologize to anybody for doing the right thing and making sure that we have a good economy here. And to have our successes, which was primarily in economic development, which brought in a lot of money in sales tax revenues and rateables, to have that, by the way, $8 billion plus in rateables came to this county in the last 6 years. To have that positive result be somehow diminished by political commentary, I think is really childish, frankly. So I just want people to understand there's a rationale to what we do, and we do it for you. That's exactly why we do things the way we do. So at the end of the day, this is a win-win for our residents. It's a bit of an unexpected holiday bonus. It's good news for a change in a year that has been kind of shy on good news, obviously. But that's where we stand now in the budget. And we'll get back to the COVID piece now. I'm going to turn this over to my communications director, John Lyon, who's been fielding your questions today that you've been submitting to us. And I thank you again for submitting those questions. We've got a lot of information today to cover.
Okay, thank you everybody for writing in. I'll get right to it as we received quite a few questions that required some really detailed responses. So the first question, is there a possibility that we will go into a shutdown similar to what we had in the spring? The numbers continue to rise each day.
Right.
What can you tell us about that?
Okay, look, our active case number, well, first of all, as far as a shutdown is concerned, let's be honest about this. It would be nice to have some humility in government at times. The best efforts that have been made to put this virus under control have been made. I will acknowledge the governor came out of the box in a time where nobody really knew what we were dealing with, put a plan of action together that basically had the 4 phases to it, came up with some strategies that seemed would be workable, and it was in conjunction with other experts in the field. Let's be honest with each other. While we had a drop-off in the high rates that we were dealing with in the spring, we don't know what really made those numbers come down. We can say, obviously, that some of those basic hygiene habits have helped, but if that was working so well, and that really, frankly, hasn't changed that much, how are we having what's being called a second wave? So it's not as simple as it seems. But so as far as shutting an entire economy down again over this, I am not in favor of that, frankly. I think there is enough a body of evidence right now to tell people that going out to a restaurant, going out to go shopping is not the sole driver of this. I think it's pretty obvious at this point. Again, things that we should be doing, we are doing. But as it relates to proper hygiene habits. But on our active case numbers have been increasing since September. The most critical number, in my view, has been our hospitalizations, which today stand at 56. I will note that even though we've had a relatively sharp increase in cases, and a case means that you test positive. You can be completely asymptomatic but test positive. So it doesn't mean you've fallen ill. But right now, the 56 number is a drop, I believe, about 8 over the last couple of days. So those numbers are well within the ability of our hospitals to deal with. And that's the most important thing, because as you recollect, the biggest challenge we had back in the bad springtime was what happens if this continues and where we're going to put people who have medical requirements. We have additional data available now publicly on our dashboards. It includes hospital and ICU bed capacity. Most of this data is updated during the week, and with active case numbers are updated every Monday, Wednesday, and Friday.
And I'll be posting a link again to our dashboards once this concludes, but they can be found via rocklandgov.com,
Right.
which is our main website.
I'm the one who usually gets that wrong, by the way.
Yes, indeed. We're trading places a little bit today. So the next question, where can we see the percent positive numbers by zip code? So we know where we stand for possible upcoming restrictions. If this is not posted anywhere, can it be added to the dashboard or some other place?
Okay. Unfortunately, New York State does not provide us with the percent positive numbers by zip code. The only publicly available data is provided to us on a county-wide basis. However, the active case numbers should give you a general idea of where we stand in each zip code. We have obviously a number of zip codes. John will be putting a link up to that particular piece, so you can take a look yourself and see what those numbers are. But the bottom line is this: this is affecting the entire county. We have zip codes. So almost 2/3 of the county is in a yellow zone right now. Zip codes right now, it's across the board. So let's focus on the fact that we need to work together to try to do our best to keep these numbers down.
Absolutely. And that brings us to our next question. Someone who has been looking at our dashboard says Nanuet has more...
Well, that's good. I'm glad. That's what we have it there for.
People are visiting it, I can tell you that. They say Nanuet has more active cases right now than Suffern. Suffern is within the yellow zone in Rockland. Nanuet is not. Why is Nanuet not being considered a yellow zone?
Okay. Look, the zone designations are made by the governor's office. We, and frankly, unfortunately, have very little input at the decision-making process. And it's just the way it is set up. But you're right. The areas of Rockland that were left out of the yellow zone expansion a few weeks ago now could have been high enough COVID activity that it could soon become yellow. So we can still see this happen. We have not heard that any changes are pending, but we must all unfortunately prepare for that possibility. The latest info on these zone restrictions and the extensive frequently asked questions, the FAQ, are available on the forward.ny.gov website. We will include a link in the comments section that will get you directly to that at the conclusion of this video.
Okay. The next question, the CDC put out new quarantine guidelines. They've throughout this, they've changed the guidance based on the best information they have and how well they know this disease. What is our local Department of Health going to recommend regarding these guidelines?
Somebody must have been looking over my shoulder. I just sent a message to our Commissioner of Health about 10 minutes ago. We were made aware of the changes from the CDC. They made the quarantine guidelines. We're awaiting further information from the New York State Department of Health. But just so you're aware of it, I communicated with our Commissioner of Health, and basically we have asked the State Department of Health to come back with recommendations. Her preference, which I certainly support, is the State Department of Health should be the one telling us what do they think. I mean, they use the CDC guidelines for a number of issues, most notably off the top of my head, opening of pools was reliant heavily on CDC guidelines. So it's not an unusual thing to do, but we would like to maintain that command and control structure that we really should have, that line authority. So we're asking the State Department of Health to get back to us. Hopefully they'll get back to us shortly. My personal feeling, I would think that we should be aligned with the CDC recommendations, but I made a point very clear to the state that understand that 10 or 14-day difference is a big deal. 4 days in a family's life means a lot, especially when we're trying to balance children going to school, being home, remote learning. hopefully understanding bosses so you can get through this. So this is not an experiment. This is real world, real life that affects people. So we're hoping for some better guidance as soon as possible. I am absolutely open to making our own decision here. I made that very clear to our Commissioner of Health today. But let's give the state a chance to do the right thing and do it the right way. Look, it always works better when we're all in the same playbook. It's something that's very, very important. It helps us understand what's going on better. It helps you to feel more confident in what's going on. When you start hearing mixed messages, it's just not really a good look. So, something has been very difficult throughout the pandemic due to frequent changes in our understanding of the disease. That alone has been problematic. So again, you've heard me say this before, nobody really has a firm, total grasp or understanding of exactly what this disease is all about. They just don't. They're making the best judgments. I have confidence in the approaches they're using, but they just don't have all the answers. And it's a frustrating thing to see. But this is when you are in a situation where you are not in a position to have a full understanding of something, the worst thing you can have is fear. You have to have some confidence in your strategies, some confidence in yourselves to do the right thing, and understand that by and large, despite the fact that we've had fatalities here, tragically so, we've had some serious illness here, sadly so, we have had a vast majority of people who have gotten symptomatic with COVID-19, who have gotten through this with moderate discomfort. So again, it is not a time to fear. It's a time to take the appropriate steps to make sure that we're as safe as we can be.
Okay. We received a couple of questions today about contact tracing, case investigation. Can you explain how that process works?
Sure.
How long does it take? And also, will contact tracers leave a message on an answering machine or voicemail, or
Okay.
do they only speak to a real live human being when they answer the phone?
Okay, very good. Okay, well, first of all, for clarity purposes, the Rockland County Department of Health, or RCDOH, does not conduct the actual contact tracing. We handle the case investigation side of the COVID response, and I'll get into that. During the investigation of each new case, we here at the county will gather information on close contacts and enter them into the ComCare, which is the new New York State contact tracing system, and then off-site and New York State contact tracers follow up with them. So we perform the basic investigation here. Those of my former fellow law enforcement personnel will understand that. They do the case folder. And then that information is offloaded to the New York State contact tracers who will follow this up. Generally speaking, this is how the process works. An individual tests positive, and our county DOH will get notified typically within 1 or 2 days, either via fax or through the electronic clinical laboratory reporting system we call ECLERS. That individual is then contacted by DOH here in Rockland County for a case investigation, the goal of which is to obtain as the details of any exposure they may have caused or been involved in. Given the higher caseload right now, there's so much happening right now, it may be 1 or 2 days before an individual is actually contacted. In the situations where schools, daycares, or work sites are involved, it may take the facility generating a contact list another day to provide it to us. I'm sure you can understand there's more people involved in that. After receiving the contact information from either the individual or another institution, the county DOH staff then enters the data into ComCare. The information on the household contacts who are most at risk is entered immediately upon receipt during the case investigation in order to speed up the process as much as possible. So as you can see, this is a lengthy process just to enroll a contact in the program. The New York State contact tracing staff takes over the process and begins calling contacts. We have noticed over the last few days, as you can well imagine, it's going to take up to 3 days now for the New York State contact tracing staff to make the first call. It's frustrating for everybody, I'm sure including you, because you want to get the information as rapidly as possible. We are trying our best. We have people locally who are trained to assist in this, and they are actively engaged in this. We're now reaching out to towns to help us out here because we have no volunteerism yet, but the towns, the 5 towns here in Rockland, and every town is affected right now as being part of the yellow zone. So it's clear, based on the statewide case numbers, that they are just as inundated with high numbers of individuals to reach out to as we are here locally. One of the factors involved in delay could be the recent school exposures, and that can create hundreds of contacts, as you can well imagine, in a school setting, despite the relatively low case numbers. But still, we have to go through the entirety of it all. This timeline does not even begin to address the situations which we've spoken of in the past, where it's been reported that people are expecting to receive a call from a contact tracer because they know of a case they believe they're a contact. The individual who have tested may never have mentioned them as a close contact during the case investigation, so we would not know about that person. If I'll give you an example, if a person attended a party that they know a case had been at, and they've never gotten a call by the tracers, if that case withholds info about that party, New York State contact tracers will not be able to call these contacts. However, we do want to state that we are receiving great cooperation from the public during our case investigation process, and we do appreciate those who are answering their phones and sharing this detailed information. It's very, very helpful, and we really do acknowledge that. Additionally, there can be other factors that create problems with the process, like issues with slow or no lab reporting, missing or incorrect lab data, preventing us from reaching a case. Added factors when a case doesn't answer the phone or doesn't provide full details such as phone numbers when they give the information to the contacts, or the numbers are wrong. We remember very early on we started this up. Having the wrong zip codes was problematic because we didn't know where the person lived, whether they were even a Rockland County resident when some of the testing was being done. But any number of things can go wrong during this process to cause someone not to be contacted. So that said, anybody who believes, and this is important, anybody who believes that they themselves to be a close contact of someone who tested positive should not hesitate. You should contact your medical provider to determine if you should undergo a quarantine. Let them hear what your circumstances are, and they will let you know if you're a direct exposure, an indirect exposure, and what you should do accordingly. Please do me one favor. If these circumstances present themselves, please do not wait to hear from either the Rockland County Department of Health or the New York State Contact Tracers Program if you know you were exposed. And yes, by the way, to earlier, I don't want to forget, the New York State Contact Tracers do leave messages, though they don't give out any information on the voicemail. That's just part of the rules that they operate under. They simply tell people that they are calling from the New York State Contact Tracing Program regarding a public health issue, and they will again try to reach them at a later time.
Okay. Thank you for that very thorough explanation of the program. There's a lot that goes into it.
Yes, there is.
Another person wrote in that elementary school students are struggling, specifically the lower, younger elementary grades. Special ed students are also in a difficult situation. They ask what can be done specifically to help the Clarkstown School District open schools safely. Why, also, quite the question,
right.
Why is school testing only going on this week?
Right.
What can you tell us about that?
That's not really true, but okay, we're helping out this week.
Yes.
Look, I absolutely understand. My children, as they were, are now 33 and 35, so I couldn't even begin to imagine the challenges parents today are facing, and I really feel for all of you because it's just got to be a very difficult time in your lives right now, and especially for our children. To have them not have that in-school setting is extremely difficult for them, and it's tough on them. The fact of the matter is that each school district determines their own plans for testing and decides if they want to remain open or not. It is not something town, village, county government does. You have a whole separate line of authority that starts with a school building, goes to the district involved, goes to the state education department, and ultimately the governor. That's how that line of authority works. Rockland County, again, does not have a direct role in that process. But that said, a lot of things we do here in county government that is inclusive, that we do things that we're not required to do. We do it because it's the right thing to do. We help each other out as much as we can. Our Department of Health recently was able to partner with the Good Samaritan Hospital to provide 1 week of testing for school districts within Rockland's yellow zone. This is what I'm presuming the questioner was referring to earlier, John just spoke about. Our Department of Health and the hospital are able to provide this assistance to our local schools this week, but they cannot guarantee the continuance of these services. Again, this is an opportunity we have. It's something we will do when we can and as we can, but it's not something that can be counted on. And just so everybody's aware of this, we've had communications with BOCES and with the school districts. They are fully aware of the fact that this is an add-on. This is something we're doing to just be helpful as much as we can to make life a little bit easier for the families who are involved and for the school districts who have to work through this. So they understand this is really their responsibility, and the districts will, really will go on with their plan of conducting testing. It's 20% weekly of the school building. And I want to commend two districts in particular, not that I don't want to leave anybody out, but two have come to my attention, the Pearl River School District and the North Rockland School District, which have testing plans in place. So I commend them for that. And this really comes down to, this is a matter of emergency planning, health, doing things to protect the public health. But testing for any person from a school within a yellow zone will continue until tomorrow. Anyone who still needs to be tested can go to the Palisades Center Mall Garage entrance west, the ramp entrance right next to Best Buy, for those who are familiar with it. There's a drive-up site or a walk-up site for those arriving by bus. Just please follow the signs that will be out there. Please complete the registration form prior to arriving at one of these sites, and the parent or guardian will need to sign the consent on the bottom of the page for testing a minor. Good Samaritan Hospital will notify you of the test results. I want to acknowledge Good Samaritan Hospital also. Both of our hospitals, Good Sam and Nyack, tremendous community partners here in Rockland County. I've never had a situation where I've gone to them to ask them for any kind of assistance, and they've never said no. So Dr. Geller, Dr. Leahy, the CEOs of both Nyack and Good Sam Hospital, respectfully take a bow. You certainly deserve the accolades for the work you do. We're going to post a link to the registration form in the comments section as the video ends. Also, before I forget, we want students to be able to attend in-person classes if at all possible. And I want to tell you that while we've had no positive cases within the schools, we have had positive cases within the schools. We have had no documented transmission in school environments, which have put safety protocols in place. There's increasing evidence that the younger ones, there's not a need to be treating the same as the older young people, the high school and college students. So it seems that that's working. It's showing some things that even though, like I said earlier, we are doing the best we can to understand this virus, but we have the basics. We have wearing masks, covering your face, keeping your face out of other people's face, even if you're familial, it's not a bad idea. Social distancing and frequent hand sanitizing and washing are effective in preventing the spread of this disease. And it's something that we've seen in the larger community as well. One of the reasons why, again, I said earlier, I'm not in favor at all of locking down the economy anymore, because you know something? There's been no data or evidence that has shown that any of these businesses that are contributing to the spread. It's just not there. The numbers are not there to show that. So it seems to me, for people who are our neighbors who are running these businesses, to be honest, they should not be punished further for doing the right thing and not contributing to any situation. And the governor stated this yesterday. He's press conference. He said nearly 70% of the cases that New York State can be traced to small gatherings, where he's calling that living room spread. So that's what we're being told by the state. It may sound kind of quirky at times to people, but the reality is that the more we look at this, sometimes we start seeing some commonality. One of the things we're seeing commonality-wise, and it's not conclusive, is that it appears, and watching this happen from the beginning of the spring, it appears that when there's a repeated interaction, that may skew the infection numbers a bit and create more infections or a spread. We can't say that for sure right now, but anecdotally, we hear enough and see enough to wonder maybe that's part of the issue, that the passing situation in a store, for example, is not likely to create a situation where you will get that sickness, but a regular routine, hanging out for a while kind of scenario may increase the chances of getting the spread. So look, at the end of the day, I can only express one thing as strongly as I can. We all have individual responsibilities. I don't care how many laws are created, how many emergency orders are created. We all had a pathetic laugh at the Thanksgiving debacle that we saw not long ago. By the way, there was not one ticket issued in the entire state of New York for anybody having 11 people at Thanksgiving. So, I mean, again, that's not the answer. The answers are being accountable, being responsible, protect yourselves. By doing that, you protect your families, your friends, and the entire county from this disease. Limit your upcoming gatherings to the best you can. Look, you live life once. Be smart about it. If you're going to have people over the house, try to limit it to the extent you can. I'm not advocating at all that we abandon the holidays. I don't believe we should do that, but I believe we can do both. I believe we can enjoy our respective holidays, enjoy the season, and do it wisely. And again, if something as easy as maybe not talk about your spouse or your children so much, but maybe your cousin comes over, maybe an aunt or uncle comes over. Maybe the interaction should be quick. It should not be a hug and hanging and breathing on each other, and that may not be a good idea. So things like that might be a smart thing to do. You want to spend time with people you live with. Help keep your distance. Wear a mask. Wash your hands. Don't touch your eyes and your face. After you've touched other things. These are the strategies we have. They may not sound like a lot, but common sense tells us they're going to work to some degree. So the more you do along those lines, the better it will be. We still have a long way to go before the vaccine is widely available. Obviously, we all have been watching what's going on, that there's an activity going on right now. Be assured that your county government will be prepared. We're already laying things out right now, and we are focused on that. We are not going to be caught short here in Rockland County. When the vaccine is made available, whatever we're being told to get done, whether it be by the feds or by the state, take it to the bank. It will get done. We will get that vaccine to you, and we will go from there. But as we get more information, right now, all we have is really what we've been hearing and reading in the paper. There's been nothing substantive that's come to us other than we're in the right direction. So once we have something of substance that can report to you, please be assured we'll get that information to you and your families as soon as we can. The bottom line is this: we have a long way to go. As I said, we have to learn to adapt to this virus. I've said this many, many times. It's not the same as the measles. We don't have those tools on our toolbox. But it doesn't mean we have to lose. It means that we have to be smart. We have to adapt. We have to believe in what we're doing. And we have to do things in a proper way. So with that, it's time to sign off. Look for those links at the end of the video, and have yourself a wonderful evening. County Executive Ed Day saying good night.